Hey guys, today we're going to teach about one of the exercises that can give you the most results and take the least time. You can do it all during your normal daily activities. It protects you when you need to lift and bend. It increases your hip range of motion, and it's one of the best to tighten up your glutes and your thighs. It's one that a lot of people do, but that a lot of people don't do right. And we're talking about a squat. We're teaching this every day in our adjusting rooms, but today I wanted to give you a chance to learn it too. So pause your video if you want to, take off your shoes if you really want to feel what it's going to be like on the ground, because we'll change your foot positioning. Stand up and join us. So to start with, we're going to start with our feet. Let me get where I don't have the sun. So you want to have your weight on the front of your ankle, or mid-ankle, but the front is best. So hold your weight on the front of your ankle, and you want to have your feet at least hip distance apart. You can have them facing forward, or you can have them faced out, whatever feels better on your hips. So to start with, you want to do what we call screw your feet into the floor. So if you'll watch my hands too, they go like this, and I'm putting outward pressure onto my feet. So practice that with me. This is my normal. I'm putting pressure in and screwing them into the floor. So I can now feel pressure all along right here and the side into the back side of my heel. I feel really stable. I feel really just connected in with the ground. The next thing we're going to talk about is your hips. So I want you to watch my legs. I'm going to change how they look based on what my hips are doing. So when my hips roll in, my legs go in. When they roll out, my knees go out. Hope you can see that. So this all is happening, and I am directing it right here. You can just move your knees in and out. That looks like this, but it isn't activating this, and we want this really active in our squat. So try it with me a couple times. Just feel what it feels like when you move your hips in and when you rotate them out. It's called internal rotation and external rotation. So now we've got our base. Your weight's over your front of your ankles. Your feet feel screwed into the ground. Your knees are out, but it's because your hips are externally rotated. Now you keep your chest up. Don't ever crunch down when you're doing a squat. Keep your chest up, keep your neck and chin up, and you start to go down. Give myself some room. So you start to go down, and you want to go down with keeping your heels on the floor. This really helps this stretch out, and it helps your hip mobility. You want the crease on your hip to be below the pit of your knee. If you can't go down that far at first, that's just fine. Come on up, using your glutes, and from right here, as soon as you get to about 3/4 up, you're going to use your glute muscles to thread your hips forward. So you don't really stand up with only your legs. We want to activate your hips and your glutes as much as we possibly can. So I'm going to show you again from the side, and we'll walk you through the specifics. So here we go. I've got my feet a little bit wider than hip distance. I like to have mine angled out a little bit. I hold my weight over the front of my ankle. I've screwed my feet into the ground. I rotate my hips externally, and we're ready to drop. So I'm keeping my chin up, my chest up, and down I go. You drop straight down. Don't let anything kind of flinch, and you go down as far as you go. You want your hips to go lower than your knees. And then as you're standing up, you come up. When you're about 3/4 through, you drive your hips forward. That's how we exercise our glutes. You'll feel that range of motion in your hips, and you'll feel it in your knees. Now, if as you start, many patients cannot go down that far. I'm losing my breath. Many patients can't go down that far at first, and that's just fine. Whatever you do will be better than doing nothing. If it hurts your knees to go down further than to go further down, bring your hips farther down than your knees, then that's fine. Stop where it hurts, but you'll be amazed if you practice it just a couple times a day at how fast that hip range of motion gets better. We use it to help people break through adhesions in their hips. We use it to help people with low back trouble, and we use it to help people strengthen their glutes and their legs. So I got a lot of the specifics from a book I've referenced before called Becoming a Supple Leopard. It has excellent step-by-step directions for really common exercises. It's by Dr. Kelly Starrett, and I'm happy to share it with you. My name is Dr. Becca from Whittaker Family Chiropractic, and thank you for joining us for Real Talk.